We are quite rotated. I don't know if you guys can see the depth of my fingers here when I go back and forth over top of the ribs. The ribs on this side are more elevated, meaning when I try and sink down beside the SPs, I go a lot further down on this side. This side, I can't go down as far. So that's further, if the fact her SPs weren't over on one side, the fact that she's elevated in one side of the rib cage and depressed in the other tells us that she is in fact rotated in that T-spine. So the thing is, sure, there could be an actual lateral deviation in the sections, but we won't know for sure to what extent until we eliminate the rotationary component. So that's probably why you're experiencing so much dysfunction over here, because these are way off over here. All right, so I am going to be performing some joint mobilizations to her upper back. When we do any sort of corrections, go ahead, let that drop. We do want to make sure we do soft tissue work first. We go in and do some corrections. You okay? Mm-hmm. And then we do soft tissue work after. Nice breath in and out. Okay, keep dropping, keep dropping. Good job. Okay, one more time. And out. Now we'll go here. I'm just getting everything reset first before I go in and load into her joints. And let that drop. Nice breath in and out. Keep falling. Good. And again, a nice breath in and out. Keep going, keep going. Your neck, let go. Good job. Good job. You okay? Mm-hmm. All right. So that's just to get the upper chest and rib cage kind of balanced out a little bit. I kind of want to bring these up a little bit higher. Anybody have any? Can I borrow those two folded linens right there, please? Because they are folded so nicely. Not bad. Thank you. Okay, well, almost nicely. That's close. Good. So we're just going to bring this up a little bit. This is probably going to be uncomfortable for a little bit, okay? Mm-hmm. Good. And let that drop. Excellent. Good. And then the other side. Thank you. Good. Good. And then we're going to bring the headpiece upwards just a little bit, okay? And is that okay? Mm-hmm. Good. Good. There we go. So now I'm going to load in to try and rotate these segments back to the way they're supposed to be. I'm going to be starting with the lower segments and I'm going to work my way up into these upper segments. And this is going to look quite intense, and Liz, this is going to be quite firm. Again, it shouldn't be painful, but it will probably be like a little bit uncomfortable. So do let me know if you feel like it's too much discomfort for you, or if you need me to stop anything, okay? Mm-hmm. Awesome. Do you have any questions about what we're gonna do before we get started? All right, if you do notice some achiness in this area, either today, later on, or tomorrow, just ice in this area that I'm working on would be a good idea. All right, can I go ahead and continue with what we're doing? Perfect, nice big breath in. And out. And drop your chest, let it fall sideways, Yep, all the way, you're doing good. Excellent, take a big breath in, try and push me back with your breath, Liz. Big breath, big breath, big breath, and falling. Good, dropping, good, keep going, keep going, keep going. Don't hold it, let it bounce through, let it bounce through. Good, let the bounce. Good job, big breath, try and push me back, push, 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 and out. Great job. Falling, let it fall sideways, fall to your left, let it go, let it go. Good, let me bounce. Don't flex it, let it bounce, you're doing good. Excellent, one more time, big breath in, push me back, push me back, push me back. And out. Good, falling, you're doing good, drop your chest, falling, good, let me bounce. Excellent. You okay, Liz? Mm-hmm. Good. Not comfy, right? No. But painful? No. No, just not comfy. Mm-hmm. Okay, so we are much closer to center, but I do want to do that one more time. I'm going to focus in this upper area. Can we do that one more time, Liz? Yeah. Good. Okay, so I always do this in a couple rounds because, well, with the curvature of the back, my flat ulnar border can only encompass a few seconds at a time. So that's why I start, move down, because the curve prevents me from being able to target all of the segments I'm targeting, right?
What's the motion you're doing with your...
Good question. So what I'm doing is I'm loading onto the TVPs that are raised, and I'm literally loading through to try and push them down to rotate her column back. Okay, so it's literally straight down anteriorly on the TVPs. name, but I was
No,
just
you
coaching her
just
through
answered,
breathing.
yeah.
No worries.
Thank you.
It's just because the breathing component is vital. Yeah, let it go, let it go. Yep, let yourself fall to the side. Fall to the side. You're doing good, you're doing good. Let go of your neck. Good. No, let it bounce through. Don't hold it. Let it bounce. You're doing great. Good. Big breath in. Push me back. Push, 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 push. And out. Good. Let yourself fall to the side. Keep going. You're doing good. Let it bounce. Don't hold it. Excellent. You're doing good. Good. Again, big breath. Try and push me back with your breath. And out. Good. And falling, falling, falling. And soften your jaw. Let that go. Good. Excellent. You're doing good. Soften your neck. Don't hold it. You're doing good. Nice. Good job. Well done. You okay? Good. Okay, so I don't have it perfectly centered yet, but we've got a lot more progress from where she was at when we started. So I'm gonna go ahead and actually move these aside a little bit, and then you guys can go ahead and assess to see what you feel in her spine after having done literally just that.